I am Shipp. I am here interviewing Dr. Jessica Klausmeier at Beth Israel Hospital. How did you end up going to Haiti?
Right after the earthquake, I wanted to see if there was anything that I could do to help. I was very sorry for the people of Haiti and for everything that they were going through. And I had an opportunity through Partners in Health, which is an organization that works with my hospital. They were asking for doctors to go down and help out at the University Hospital in Port-au-Prince. And I was lucky enough to have a vacation around the same time they were asking for doctors to go down there. So I got to travel down there with a big group of people from my hospital, a bunch of doctors, nurses, physical therapists, occupational therapists, to go down and help with staffing in the night shift for the University Hospital.
How long did it take you to get there?
The trip itself took, I think, about 5 or 6 hours. We got to go on a private jet, which was pretty cool, that someone had donated. I didn't get to go right initially when the earthquake happened. It took about 6 weeks after the earthquake before I could get down there. They just had to do some logistical stuff and organize things, and that was when we were needed. So that's when we went down.
What did you do for children while you were there?
When we were there, we were working at nighttime in the University Hospital, so we saw all the patients in the hospital. We saw all the patients in the hospital at nighttime, so anybody that was sick. We saw adults, we saw kids, we saw older people, and we just did all the basic medical care that they needed for when they were in the hospital. So the babies had all different kinds of problems. Some of them had problems with diarrhea, stuff like that, feeding problems. We delivered a lot of babies while we were there. And then the adults had all different kind of problems. Some issues that were related to the earthquake, like injuries and things like that. Some that were just general medical problems that hadn't been getting addressed because the
What did you do for children while you were there?
When we were there, we were working at the University Hospital. We were working at nighttime, and we took care of all the kids in the hospital, all the adults in the hospital overnight. Any kids that were sick, we had a lot of kids that had diarrhea, had injuries from the earthquake. We took care of them the best we could and helped with feeding. A lot of them have problems with feeding. And then for the adults, we took care of all of their medical problems. Some of them had injuries related to the earthquake. Some of them just had medical problems like heart disease and diabetes and high blood pressure that were not being addressed. So we took care of all of those issues.
Okay. Did you visit any orphanage or school?
We were lucky to go down to Haiti with a group of nurses that are from Haiti. And a lot of them had homes in Port-au-Prince and then outside of Port-au-Prince. So I got to go with one of them on one of my days. I took one day off, and I went with one of our nurses to her vacation home, which is right outside of Port-au-Prince. So I got to see the countryside, and I actually went to one of the cemeteries there, which was kind of interesting, and one of the churches there. But I did not get to go to any schools or orphanages because we spent most of our time in the city, and all those structures were just completely demolished. They weren't really up and functioning, so we weren't able to do that. They didn't have the schools running when I was there.
How do you feel that we can help the people of Haiti?
I think that that's a complicated question because the people of Haiti and the country needs so much still. There was so much destruction, and pretty much every level of their system was kind of broken down. So I think it kind of depends on everyone's level of expertise. So for me, it was good for me to go down and provide medical care because that's what I know how to do. For people with money, I think it's helpful to provide money because there's certainly not enough money. People that know about things like adoption and things like working with children, it's good to go and help with those issues. So I think there's lots of different levels of things that people need. So I think there's lots of ways people can help. It just depends on somebody's personal expertise.
Will you go back?
I would love to go back. I am in residency still, which is a demanding schedule, so it's difficult to try and figure out the time to go back. I think I'm going to try and go back to the same hospital I was working at next winter is the plan. But I would love to go back sooner than that if I could.
Thank you for supporting Eagle for Haiti.
You're very welcome. You're doing a great thing. You should be very proud of yourself.